On the eastern shore of Maryland, a community is working with their school system to bring a new way of introducing health and wellness to students.
Keep kids healthy.
It started from us thinking about our problem from a healthcare provider standpoint is the fact that consumers of healthcare do not have a grasp of what they're consuming. Globally, 29% of the people are obese or overweight. So how do we create better consumers in healthcare and start that at a younger age?
If we can teach children now what it means to have literacy in their food choices, as a community won't have to take care of them in the future in terms of social needs, from medical issues.
The local hospital reached out to Worcester County Public Schools and the Herschel S. Horowitz Center for Health Literacy at the University of Maryland School of Public Health to introduce a pilot program of health literacy lessons to second graders at Ocean City Elementary School.
Health literacy is the ability to understand and use health information to make healthy decisions. There is almost no research on health literacy in children because of the challenges that the developmental stages of childhood impact the ability to measure something. So with the hospital, which was the healthcare expert, the school system, which was the curriculum expert, and the center, which was the research and health literacy expert, we worked with teachers to develop lesson plans that they could use in their classrooms to build health literacy skills.
And it asks you 2 questions about it.
They didn't know a lot about health literacy, so the first piece of the project was really educating them on health education versus health literacy and the difference between them. Then they decided to take a look at their existing curriculum. So what reading program or what books are they currently using? What science concepts are they currently addressing? From there, they took a look at those things they're already currently using in their classroom and then paired them with the 5 health literacy standards that were developed by the Center for Health Literacy at the University of Maryland.
And each lesson plan addresses one of the wellness goals. One's on safety, one's on physical activity, one's on nutrition, one is on communicating with doctors and nurses. So it addresses those overall health objectives while also addressing skill sets that the students need to understand health information better.
The second lesson that we taught to them was about a trip to the emergency room. What would happen if they actually had to visit the emergency room? And with the help of Atlantic General Hospital, the nurses came to our classroom and shared an actual scenario.
So when you come to the emergency room, what's the first thing we need to know?
And the last unit was on the media and its influence on kids' choices.
We're learning how to read food labels. We're thinking, is this a good choice or is this a bad choice?
Whether teaching health literacy in the classroom will result in healthier lifelong choices remains to be seen, as the research is still in its infancy. However, one-on-one evaluations with each second grade student look promising.
They are answering questions. They're all getting the peanut allergy question correct. And when we say, well, do you know what any of these words mean? They say sodium means salt. One child said, protein means getting stronger muscles. Sugar means too much sugar is bad. So they're incorporating what they're learning in a way they weren't. So we're very optimistic about what we'll find in this data.
I think it's important, especially for younger children, because they don't know any different unless they're being taught at home. I mean, their family, their parents could be eating unhealthy and they think it's normal because their parents are eating it.
Why is it not healthy? Abigail?
Because it probably has artificial fruit flavors, or if it has real fruit, it's probably that much. And pretty much the whole bottle's filled with sugar.
Yes.
School systems are no longer just required to do reading, writing, and arithmetic. We're teaching responsibility as well. And the school board has been very proactive in looking at the whole person, creating responsibility as young adults so that we can make positive influences in our lives later on.
We've got to get down to really where the next generations come from, and we've got to plant seeds in that soil.
Hey!